for giving us the opportunity to share with you the most important data in a nutshell on a study we call the outcome of 129 children after antenatal exposure to cancer treatment. And this is a case control study conducted by the International Network on Cancer, Infertility and Pregnancy Registry. In the first interim analysis we published 3 years ago, there were two negative aspects. We did not have a control group, and we included children of 18 months until 18 years, so the age distribution was quite high, and that's what we wanted to improve in this study. And as you can see here, we included 129 children born to mothers with cancer with pregnancy, and they were matched in 1-to-1 with 129 control children born from the general population. There were 89 children exposed to chemotherapy, some with surgery, 4 to radiotherapy, some with surgery, 7 with chemotherapy and radiotherapy with or without surgery, which means that 96 children were exposed to chemotherapy, 11 to radiotherapy, which means that in total 100 children were exposed to chemo and or radiotherapy. But 1 child received trastuzumab, 1 interferon beta, 13 children surgery only, and 14 children, in fact, there was no cancer treatment, but there was cancer diagnosis, there was the stress during pregnancy. What did we do? We looked into the general health. We did a general pediatric and clinical neurological examination, and there was a general health questionnaire for the parents. We looked into the cognitive outcome. We did do the Bayley scales of infant development, the 2nd or the 3rd edition by a psychologist, and we looked into detail in the heart morphology and the heart functions by doing an echocardiography and an electrocardiography. Looking into the postnatal growth, we see at the left males, at the right females. We look into the length, is the above curve, into the weight in the middle, and the head circumference at the bottom. And as you can appreciate, actually most of the values in fact fall between the 5th and the 95th percentile. In the study, 61% of the children was in fact preterm, and 22% were actually had a weight lower than a 10th percentile, which is in fact a double as what you would expect. But of these children, 64% actually had a catch-up growth until normal growth measures. Looking into the general health, there was, we looked into incidence of medical problems, internal medical problems, surgery, medical care, but in fact there was no difference between the study children and the control group. This is in fact the most important slide. We looked into the cognitive outcome, and we see in the full line actually the study group and the dotted line control group. And as you can appreciate, there is in fact no difference regarding the cognitive outcome between children antenatally exposed to cancer treatment or cancer versus controls. If you would use this curve only for chemotherapy group, only radiotherapy group, or only surgery group, it would be the same result. So the form and the difference between the controls and the study children is the same. So this is reassuring. We also looked into the number of chemotherapy cycles, and as you can appreciate from this slide, we see in the y-axis the cognitive outcome, and in the x-axis the number of chemotherapy cycles, and there is no difference between children antenatally exposed to 1 or 2 cycles of chemotherapy or 6 or 7 cycles of chemotherapy. So also this is a reassuring observation. But we did find a very interesting observation, and this is shown here. We see the cognitive outcome again in the y-axis and the gestational age in the x-axis, and you can appreciate that as the pregnancy continues, that actually the cognitive outcome is better, which means on the reverse, if a child is born preterm, the cognitive outcome is worse. But what is new now in this study, and we could not document this in our previous interim analysis because there was no control group. So what you can appreciate here is that the effect of prematurity, the negative effect of prematurity, is the same for control children as for study children. So which means that prematurity is a problem and chemotherapy is not a problem. And this is a novel observation when compared to the previous findings. If we translate this into the clinic, If we put 10 children on a row, and this is what I want to express with this slide, if you have 10 children and 2 children were exposed to chemotherapy antenatally, I will not see the difference, you won't see the difference, but in particular, if my researchers examine these children cognitively, and if they look into the cardiac function, they will they also will not be able to identify which child actually was antenatally exposed to cancer treatment. These data are now accepted for publication in the New England Journal of Medicine, and they will go online at 3:15 this afternoon. As you can see, it is an initiative of the INSIP, the International Network on Cancer, Infertility and Pregnancy. I have to acknowledge the institutions where I work and the institutions that support financially our research.